All right, our final presenter is Rowland Ramdass, who is an assistant professor in allied health here at Hostos.
Hello, everyone. I wanted to welcome my colleagues that are here to support me, and also to just to say, I teach nursing. I teach the evening nursing class, and for the most part, my students are full-time employed, and they are coming to class at 5 p.m. And class is usually typically 3 hours. So finding ways to keep them awake and engaged, as all of my fellow colleagues have presented on, and keeping them engaged have led to finding some creative strategies. So where we're at in current nursing education, currently in nursing education, there's two organizations that we kind of listen to that help to sort of how curriculum and how pedagogy is evolving. And one of them is the Institute of Medicine, and their quality chasm has identified serious gaps in patient safety, quality of care, and have fueled a debate on changes that are required in healthcare professional education. Now, this started way back in 1999 when there was a study that found that there was 98,000 patients that died from medical errors, and it was called "The Error is Human." And since then, they have started to make changes that have continually affected the way hospitals work and so on and so forth. Then the thing about nursing education, it's always follows medical model and is a few years behind. But QSEN is quality and safety education for nurses, and this project is being funded by Robert Wood Johnson Foundation. And this organization actually defined competencies for integrating a quality and safety framework. And they actually have these 6, what they call QSEN learning competencies. And the 6 are patient-centered care, teamwork and collaboration, utilizing evidence-based practice, quality improvement, safety, and using informatics, which is the technology part of nursing education. So how do we, as faculty, integrate some of the QSEN competencies? As faculty, we integrate the knowledge, skills, and attitudes that define these 6 competencies. It is clear that how we teach define our attitudes and behavior. We all know that lecture alone rarely achieves changes in behavior and attitude. Then, as nursing faculty, we grapple with content explosion in knowledge and technology. Look, when I went to school and I took pharmacology, there was one blood thinner called Coumadin. That's it. I had to learn one drug. Okay? There was heparin and Coumadin for my anticoagulation, and that was just in the late 90s. Now I have to teach students. Some of you may have seen the commercial. There's Pradaxa, there's Eliquis, there's Xarelto, there's Coumadin, there's Lovenox, and they go on and on. And that's just one example of one type of drug that we have to teach our students in. So there is this big explosion of how much to teach and what there is. So the QSEN pilot project came up with narrative pedagogy as an effective way to close the gap between classroom didactic and clinical experiences. So what is narrative pedagogy? So Tom Ironside, who started this type of pedagogy, said that it is an interpretive phenomenological pedagogy that gathers teachers and students into conversation, wherein new possibilities for practice and education can be envisioned. So I think of this as narrative pedagogy, an approach to thinking about teaching and learning that evolves from the lived experiences of teachers and students. So at Hostos, I went ahead and implemented narrative pedagogy to get my students involved. I wanted to have my students share their life experiences. I wanted to hear from them. They come to class, like I said, they've worked all day, they're tired. Putting up a PowerPoint and going through content wasn't, I think, ideal. So by them sharing their life experiences, and the way I mapped this was to whatever the content we were doing, and I'll get into some of the things in a second. And they would write a story. From what I learned, and the best part of teaching is when you learn from your students, is that I really get to learn some of my students' experiences. I make them write their narrative as a story prior to attending class. Some of these narratives have been very, very emotional. And some of the students have had to actually have their classmate read their assignment because, it's a time when they really, they may start to cry and there's an emotional bond that sort of creates around the close. The technology part, my students, I say to them, listen, you guys are in an associate degree program. You're all going to continue with your baccalaureate degree, and you need to utilize technology, and you need to start thinking about online so much so, as my colleagues have talked about. And some of them really before had barely sort of logged on to Blackboard. Their interaction with Blackboard would be to just kind of go and download their PowerPoints and so forth. So by then having to upload their assignments via Blackboard, where I can then give them feedback, was a way for them to start to utilize the technology so that when they continued, they would at least get an understanding of how to upload assignments and so forth. So it sort of helps with a couple of different things. Now I just wanted to share with you some of the things that we learned and how I implemented narrative pedagogy. So on the day that we covered skin, I said to the students, write a story about something that was personal to you. And it doesn't have to be a descriptive. The one thing, and the instructions I give is do not open up the textbook and tell me what psoriasis is. Just don't duplicate multiple topics. So I don't want 5 students writing about psoriasis. So I created a blog on Blackboard so everybody would list their topic. So when we get to skin, a student would then read about, would write her story and then read her story. So this student wrote, the scaly patches covered nearly 50% of my body, and I was extremely depressed. I hated going out, and my biggest concern in the morning was if my clothing covered up every single patch. I always felt like people were staring at me, and was so self-conscious of my appearance. By this time, the psoriasis was on my scalp, forehead, even my hands. There was no hiding it, no matter how hard I tried. Being in junior high school was hard enough. Imagine trying to deal with a rash that your classmates all thought were contagious. I felt like the freak of the class. Now, there's no way in a PowerPoint training nurses to be better clinicians, to be understanding, to be able to understand culture and to be able to understand human response to illness. Could I stand in front of a class and talk about this? One example. We talked about GI, and we were talking about different types of surgical weight loss management. One student said I wanted to write about obesity. This is an excerpt from her narrative. It didn't really bother me unless we were walking somewhere. And he would stop every 2 blocks to catch his breath and take a breath, and I was in a rush because people would see me with him. Still, I didn't really notice that he was obese until I would hear him and my mom argue about it, and I would hear her express her feelings of disgust. She was describing her dad. I remember one family vacation that my dad stayed in the hotel room the entire trip because he insisted he couldn't get around like he used to. My dad would eat at night. I remember one day I came into the kitchen and saw him eating peanut butter and jelly right out of the container with the spoon. I expressed my feelings of anger and disgust and walked out of the room. She then went on to say, as a nursing student, I realized that I will most likely have to deal with a patient who may be struggling with weight issues. And I will have to use my self-reflection and be careful not to counter-transfer my personal feelings onto my patient. Again, I just can't stand in front of a classroom and teach this via PowerPoint or, it's very powerful, very powerful. I found that it brings us together as a class by students sharing their stories, and the stories have been on and on. Stories of students in the military, seeing when we talk about trauma, and so on and so forth. So, so far it's been working really well, and the students here at Hostos absolutely look forward to sharing their stories, and some of the issues I have is that the week when we're ready to cover the topic, they're like, oh, I didn't get my story written, and you know, there's a little bit of shuffling around sometimes, but they really do enjoy writing their stories. Okay, I think we made it to lunch.
Have you ever, Dr. Ramdass, had a student reveal something that was uncomfortable for the group?
Yes, students have revealed things. One student talked about a drug addiction.
Wow.
And you know, everyone was sort of kind of speechless and you know, got really uncomfortable. Yeah, so the topics, and you know, there was just a silence. We took a break. But I feel overall it's really brought us together as a group. Really brings us together.